Hello and welcome to Ask the Oncologist. This is Dr. Kpatsi. Today I'll be talking about the risk factors that are associated with prostate cancer. Now, when it comes to the development of prostate cancer, the number one risk factor is age. As a man grows older, his risk of developing prostate cancer increases sharply. In the clinic, majority of the men that we diagnose of prostate cancer are between the ages of 60 and 70 years. In fact, prostate cancer is less common in men who are less than 40 years. But to let you understand the association of age with the risk of developing prostate cancer, look at this. The incidence of developing prostate cancer in men who are between 50 and 60 years is about 1 in 58 men. Whereas this incidence rises sharply to about 1 in 21 men when a man is between the ages of 60 and 70 years. This further increases sharply to about 1 in 12 men when a man is older than 70 years of age. In fact, autopsy specimen or autopsy data actually show that about 40% of men who are older than 50 years had some evidence of cancer in their prostate, whereas this figure rises to about 70% for men who are older than 80 years of age. So you see, as a man grows older, his risk of developing prostate cancer increases sharply. Another key risk factor that is relevant when it comes to prostate cancer is family history. In fact, family history, we do realize that for people who have one first-degree relative, 2 first-degree relatives, and 3 first-degree relatives have an increasing risk of developing prostate cancer in this particular order. More so, there are some genes that can be inherited in the family line, like BRCA1, BRCA2 mutations. These genetic mutations, when inherited from other family members, increases one's risk of developing prostate cancer. Now, another important risk factor to talk about when it comes to prostate cancer is race. In fact, the highest rates of prostate cancer are recorded in men who are coming from the Scandinavian countries. In fact, in these areas, prostate cancer is the highest cause of male cancer death, whereas the lowest rates of prostate cancer are recorded in men that are coming from the Asian countries. In the United States, African Americans have the highest incidence and mortality when it comes to the development of prostate cancer. So you see, race is a very, very important factor to take note of. By being black, you need to realize that your risk is high compared to your Caucasian counterpart. And it is relevant to be aware of it and then screen yourself appropriately so that you are not caught unaware. Now, another important risk factor to talk about when it comes to prostate cancer is lifestyle. We do know that men who are obese have a higher risk of developing prostate cancer than men who have a lower body mass index. More so to men who have less physical activity, that's people who live a sedentary lifestyle, who do not partake in any active activities on a daily basis, also have an increased risk of developing prostate cancer. Now, let me quickly add that we do know that there are some dietary components that can reduce the risk of developing prostate cancer in men. For example, it is known that men who consume broccolis, cauliflower, and tomatoes have a reduced risk of developing prostate cancer compared to men who do not. So this gives you relevant information for you to act on in reducing your risk of developing prostate cancer. I hope I've been able to help you understand the risk factors that are associated with the development of prostate cancer. In the next video, I'll be talking about relevant signs and symptoms that every man can look out for. This will help you to be able to know ahead of time if there is something developing, something unusual like cancer developing in your prostate, so that you can seek treatment early. Don't forget that early diagnosis saves lives when it comes to cancer. If you like this video, don't forget to share and then also like and then subscribe to this channel so that this message can get to so many more people. Thank you very much. See you in my next video.